Good day, everyone. We are third year nursing students from Columban College Incorporated. My name is Annabelle Rawls, and my co author here with me is Kishal Cañeda. We are going to present our research study entitled Clinical Experiences of Nursing Students and Their Level of Confidence Basis for a Support System. This research study aims to describe the clinical experiences of Columban College Level 2 to 4 Bachelor of Science in Nursing students who are currently undergoing clinical exposure to identify their challenges in clinical setting and to offer necessary support for them.
Columban College is a Catholic institution located in Olongapo City, Zambales, Philippines, and a part of the Diocese of Iba. It houses six colleges: the College of Computer Studies, the College of Business and Accountancy, College of Arts and Sciences and Education, College of Engineering, College of Architecture, and the College of Nursing. This Catholic institution has a long history of producing globally competitive professionals.
Existing research on nursing students' clinical exposures were aimed to explore the student experiences in the clinical settings. However, only few literatures address how these experiences affect their level of confidence as future healthcare professionals. Therefore, this study entitled Clinical Experiences of Nursing Students and Their Level of Confidence Basis for a Support System aims to fill the gap by identifying the nursing students' challenging experiences in the clinical setting to eventually provide a support system for them.
Clinical exposure plays a crucial role in the education and training of nursing students. It provides them with practical experience and allows them to apply theoretical knowledge in real-life healthcare settings. The level of confidence exhibited by nursing students during their clinical exposure is a significant indicator of their preparedness to enter a healthcare profession. According to Phillips and Duke year 2019, clinical experiences enable nursing students to integrate theoretical knowledge with hands-on practice, fostering the development of critical thinking, decision making, and clinical skills. Moreover, nursing students' self confidence and ability to handle challenging situations are significantly influenced by the quality and quantity of the clinical exposure, according to Forsberg et al., year 2017. The transition from classroom to the clinical setting can be overwhelming for nursing students, leading to decreased confidence levels and increased stress and anxiety by Michelle et al., year 2021. Lack of confidence may negatively affect students' performance, patient care outcomes, and their overall perception of nursing profession, according to Welland year 2020. It is therefore crucial to identify factors that contribute to nursing students' confidence during clinical exposure and develop appropriate support systems to address their needs.
The research objectives of our study are to assess the level of clinical exposure among nursing students, to measure the level of confidence among nursing students, and to examine the relationship between clinical exposure and nursing students' level of confidence. By addressing these research objectives, this study aims to contribute to the existing knowledge on the relationship between clinical exposure and nursing students' confidence levels. The findings will inform the development of evidence-based strategies and support systems that can optimize the clinical learning environment and facilitate growth of competent and confident nursing professionals.
The theoretical framework of the study was anchored from the theory-practice gap in nursing by McKenna et al. They propose a new dimension for understanding the theory-practice gap, which consists of four interrelated factors. First is the educational factors. This dimension explores the role of nursing education programs in preparing students for practice. The author emphasized the importance of integrating theory and practice throughout education and promoting critical thinking and reflective practice. Next is workplace factors. The dimension focuses on the healthcare organizations where nurses practice. The authors emphasize the need for supportive work environment that value ongoing learning and professional development. Next is professional factors. This dimension explores the broader professional context nursing operates. The authors highlight the importance of professional regulatory bodies, professional networks, and continuing education to bridge the theory-practice gap. Next is the societal factors. This dimension recognizes the influence of societal expectations and perceptions of nursing practice. The author emphasized the need to promote a positive and accurate image of nursing to enhance the integration of theory and practice. This theory provides a comprehensive analysis of the theory-practice gap in nursing and proposes a new dimension that considers individual and systematic factors. It highlights the need for collaboration among educators, healthcare organizations, professional bodies, and society as a whole to address the gap and create an environment that supports the transition of theoretical knowledge into effective nursing practice.
The researchers used a descriptive correlational study designed to determine the association between the demographic variables and student experience in clinical settings, to ensure a better representative of the population and at the same time to produce statistically accurate research findings. The maximum possible number of students were included. The researchers used a self-constructed questionnaire to collect data for the study. The instrument was tested for validity and reliability by two experts in the nursing field before being distributed to 10 nursing students from Gordon College, College of Nursing for a pilot study. Throughout the procedure, confidentiality and anonymity were maintained. The student respondents were given the option to stop participating in the survey questionnaire if they were unable to do so. The collected data were handled, analyzed, transferred, and stored with the highest care and secrecy. The researchers produced an online questionnaire that was evaluated by Columbian College's Director of Research Innovation Knowledge Development Office. The researchers' data were presented, analyzed, and interpreted using percentage, weighted mean, and Pearson R.
The results imply that the nursing students can generally catch their clients' attention when discussing medications, procedures, and health conditions to their clients. This points to the students having sufficient knowledge and good communication skills in relaying salient information. This was supported by Moorhead Year 2014, who stated that nursing students who develop strong relationships with patients are more likely to adopt patient-centered care practices, resulting in improved health outcomes and better patient satisfaction. The relatives of the client relay their concerns about their client to the nursing students. These concerns are more critical in the care of the clients because of the relatives. They are the one at the bedsides most of the time. This implies that when the student builds good rapport, even with the client's relatives, they are being trusted and involved in the care of the clients, which brings about a good experience to the students. This was further supported by Bruce and Witz, year 2014, who stated that communication with families can be particularly important in mental health care, where collaboration between healthcare providers and family members can be critical in ensuring optimal patient outcomes.
As the results imply, staff nurses are generally willing to impart their knowledge to nursing students regarding clinical procedures when needed. This shows that staff nurses see the lack of experience of nursing students and take the initiative to step in and guide them, as they are also once nursing students who needed guidance. This was supported by Levitt Jones 2008, who stated that a positive clinical learning environment encourages student advancement and retention within the nursing education program, which speeds up their learning and helps them develop their sense of self as nurses. The respondents also generally treat their co-affiliates with respect, which reflects the positive values that the school has inculcated with their students, be it in or out of school grounds. This was further supported by Hosoda 2018, who stated that in terms of psychosocial and interaction factors, since student nurses hone their clinical skills by observing, imitating, and practice, positive interactions with hospital staff and co-affiliates support clinical learning.
The result from the NICO and NSU implies the effectiveness of the inclusion of health assessment as a nursing subject that harbors confidence among students in properly assessing clients in the first year of nursing school. This was further supported by Potter et al. Year 2017, who considered nursing documentation as an essential part of safe, ethical, and effective nursing practice, regardless of the setting or whether the documentation is paper-based or electronic. The results for the experience of the respondents implies that the students employ their therapeutic communication skills in keeping the pediatric client calm, thus minimizing the risk of injuries, especially during medication administration. This was then supported by Eunice et al. Year 2015, who discovered that after implementing a designed therapeutic communication program, pediatric nurses significantly improved their knowledge and abilities in therapeutic communication with the hospitalized child clients.
In the OB/GYN ward, results show that the respondents are confident in monitoring a client's vital signs, which implies the thoroughness of the training being conducted as part of the curriculum before students are being sent out to clinical areas. This was then supported by Urquhart 2018, who found that nursing record systems may be a useful tool for influencing nurse practice to evaluate how nursing record systems affect patient outcomes and nursing practice. In the delivery room, the majority of the respondents are knowledgeable in proper medical waste management and disposal protocol in the area while ensuring the proper maintenance of sanitation within the area. They are also confident in monitoring a client's vital signs. This highlights the effectiveness of the reiteration of the value of proper sanitation among nursing students starting in the classroom setup. This was then supported by Suwan Nabal and Suwacha 2012, who stated that student nurses must prepare their knowledge, body, and mind prior to the practicum, particularly the one in the delivery room, due to the urgency of the situation, as there are numerous factors that contribute to fear, anxiety, and stress, which includes nursing care for pregnant ladies with intrapartum work torment.
The results from the operating room indicates that the knowledge acquired by the respondents in the classroom are being well practiced and implemented in the respective areas of their clinical duty, which will then enhance the respondent's skill, build up confidence, and incorporate more knowledge in their respective clinical area. This was then supported by Kaya et al. Year 2007 and Shu et al. Year 2002, who stated that the operating rooms are distressing the students because of their specific structure, operational rules, and experience on patients, and the first-time experience of the students with regards to an operation on a patient. The results from the emergency room suggest that the respondents' classroom information is being exercised and utilized in their separate areas of clinical duty, which will then improve the respondents' skills, confidence, and knowledge in their specific clinical area. This was then supported by Potter et al. Year 2013, who stated that confident nursing students will become more effective nurses.
In the dialysis area, the majority of respondents recognized that their experience in the area allowed them to explore their capabilities and limitations in a complex environment. The results show that despite the challenges, the respondents are confident in taking care of clients' needs, giving them their medications, and monitoring their vital signs. Auger et al. 2007 and Shu et al. 2002 stated that hemodialysis nursing is complex and challenging, and nurses are required to provide patient-centered care in a highly technological environment. The experience of nursing students in the medical ward shows that the respondents are confident in monitoring the client's vital signs, managing the client's records, administering medication, and effectively utilizing the equipment used in the area. This shows that the knowledge the respondents learned in the classroom is being effectively applied in their respective clinical duties, which will then improve the respondents' skills, confidence, and incorporation of additional knowledge in their respective clinical area. This was supported by Brink et al. 2008, who stated that it is essential that student nurses work under the supervision of nurses during clinical practice in the medical wards to improve learning and confidence in treating patients.
In the surgical ward, results show that the majority of the nursing students expressed consensus that their time spent in the surgical ward had proven to be highly advantageous when it comes to developing a sense of confidence in monitoring vital signs effectively and competently. This result suggests that the experience gained during their tenure in the surgical ward played a crucial role in equipping the nursing students with the necessary skills and knowledge to adaptively observe and assess vital signs, fostering a sense of assurance and competence in this essential aspect of their profession. According to Coban and Casici 2006, Shu et al. 2002 stated that patients are pleased with the nursing care given by student nurses since they were able to spend more time with each patient and give them individualized care. When it comes to the respondents' level of confidence, results show that the majority of nursing students are extremely confident that they are gaining essential information through clinical learning to accomplish significant tasks in their clinical practice. This indicates that the nursing students are being competent and confident to complete a task. This was then supported by Hart, Spira, and Moreno year 2014, Shu et al. Year 2002, who suggested that nursing students must have high level of self-confidence in their abilities to conduct appropriate health assessments, perform effective intervention, participate as an effective team member, and recognize patient deterioration events.
Furthermore, most of the respondents are confident in their ability to provide easy-to-understand terms in answering clients' queries. This indicates that student nurses have sufficient knowledge and are well-trained in terms of presenting reliable and accurate information with minimal use of medical terms. Papathanassiou et al. 2014 and Xu et al. 2002 stated that critical thinking is a vital step for safe, effective, efficient, and skilled nursing practice. Additionally, the majority of the respondents generally agree that they can withhold any confidential client information from their relatives when needed. Therefore, this indicates that the respondents have a thorough understanding of the significance of data privacy in their field. This was then supported by Adams 2017, who suggested that nurses considered communicating with families a vital part of their role and described supportive behaviors. However, they perceived significant barriers to effective communication, some as a result of active decisions on their part and some beyond their control.
Furthermore, the results imply that they are equipped to manage the situations given and presented to them without any complications. These results indicate that the first-hand exposure to various forms of bodily secretions has significantly contributed to the students' understanding and recognition of the inherent normalcy of such procedures in their specific field of expertise. The results therefore imply that confidence influences every aspect of healthcare providers' clinical performance in many areas, including their relationship with clients, relatives, co-affiliates, and other healthcare team members. The main goal of nursing education is to produce qualified nursing graduates who are able to perform and anticipate clinical skills.
Findings of the study suggest that student experiences in different clinical areas have high positive correlation with regards to their level of confidence in performing clinical procedures, answering the queries of clients' relatives, doctors, staff nurses, clinical instructors, and their exposure to body secretions such as blood. This shows that a positive relationship between the students and the people around them will raise their level of confidence and therefore bring about a better clinical experience and a more conducive learning environment. This also helps them in mentally navigating the possible transition shock when being exposed to body secretions such as blood and to other situations that are not experienced in a classroom setup. Among all the variables presented, the highest positive correlation was shown between the relationship of the students with their clients and their level of confidence in performing clinical procedures. This supports the literature that nursing is a patient-centered profession, and when the student effectively builds rapport with their clients, it will not only be beneficial for the student in training, but most importantly to the client as they will be receiving the proper care that they should be getting. Nursing schools need to be concerned about finding solutions to student issues in the classroom and in hospitals. The result confirms the requirement that the nursing curriculum in terms of clinical learning be planned such that nursing students be actively involved in their education.
Future researchers should further examine the relationship between the acquired level of skills that the nursing students have mastered throughout their exposure to the clinical area and how it affects their level of confidence in performing quality nursing care to their patient on a much larger population. The researchers also considered suggesting to the future researchers to further work on how to offer support system to the nursing students in light with the worldwide modernization of classroom setup, particularly the hybrid classes wherein students are forced to adjust to the new normal as well as the modern dissemination of healthcare assistance going online. The inclusion of transferees and irregular students as variables is also strongly advised.
For the impact and outcome, a plan for the inclusion of offering counseling in between clinical duty days for nursing students who find it hard adjusting to their new environment should be put in place. Furthermore, debriefing discussions among the students to be facilitated by their clinical instructors should be encouraged, as learning in highly stimulating environments should be free from external constraints, as stated by Gururaja et al. 2008. Reorientation for hospital staff should also be in place, as they are the ones playing key roles in the learning of the nursing students in the clinical area.
Here are the references used in this research study. And once again, I am Keishal Cassandra R. Cañada and my co-author is Annabel M. Rolls. Thank you for listening.